again to all my listeners and now some viewers to the EMS Pod with Chief Randell. I want to thank you again for joining us and finding another incredible guest, a person who has her hands in many pots. From a guy who likes to eat lots of food, I would say that this person has a buffet of activities happening, and all in a very good way. It's Dr. Owusu, and I want to make sure that I say her name correctly because this is a powerful person with a powerful name. Hello, doctor. How are you?
Hi, Chief Randell. How are you?
I am fantastic. Thanks for taking out the time out of your really hectic schedule to sit down and just talk to me and to give some of the listeners an idea of really who you are and what's happened in, dare I say, the great state of Pennsylvania.
Well, thank you for this opportunity. I'm really excited.
Well, good. So something happened recently with, I think there's a team that plays football in that state that won a Super Bowl, and there was a party, and I am a Vikings fan, so I'm not going to get into that too heavily, but I guess we're happy for you.
Yeah, I mean, that would be on the other side of the state. So I would think there'd still be a little bit of a rivalry, though I will be in that Benoit city in a few days, actually, doing a trauma lecture, pediatric trauma lecture. So yes, we congratulate our fellow Pennsylvanians in the city of Philadelphia, brotherly love.
Yeah.
But still bleed black and gold on this side of the Commonwealth.
I appreciate that. So, Dr. Owusu, why don't you give the listeners a little bit about yourself, a little background, and tell them what you're up to.
Yeah. So my name is Dr. Sylvia Owusu-Ansah. I am EMS Medical Director at UPMC Children's Hospital of Pittsburgh. I'm one of the first to do pediatric emergency medicine and EMS kind of together. If you look at EMS medical directors throughout the country, over 90% of them are trained in emergency medicine and not necessarily pediatrics. So I'm happy to be a part of that group, pioneering group. And also I am Associate Professor of Pediatrics and Emergency Medicine at the University of Pittsburgh School of Medicine. I was born in the wonderful city of Boston. So to be truly honest, I'm a Patriots fan and a bigger Celtics fan. But I was raised all over the place, including Lexington, Kentucky, Concord, New Hampshire, and more interestingly, in Namibia, Southern Africa during the height of apartheid, where my stepfather, who I call my father, worked for the World Health Organization at the height of the HIV/AIDS pandemic. And so his job was to advise the newly minted government in Namibia on HIV and AIDS education. So I saw firsthand the travesties of HIV and AIDS took upon Southern Africa, but I also witnessed the triumph of Nelson Mandela becoming the first Black head of state in South Africa. We were actually in Cape Town in the streets celebrating with people while I was a teenager. I soon came back to Boston to finish my high school education. And then my medical education kind of took me all over. I did college at the University of Rochester in upstate New York, completed my medical degree at the University of Chicago, Pittsburgh School of Medicine in Chicago, Illinois. And then at the Johns Hopkins, I did my master's in public health and two of my fellowships, pediatric emergency medicine and EMS fellowship. I was the first Black and female EMS fellow there. I was actually one of the first fellows at Johns Hopkins School of Medicine. And then I got my big girl job here in Pittsburgh. So that's where I am here today. And so I've traversed the country and the world, and I've experienced, being the only Black in an all white, elementary school in Concord, New Hampshire. I've experienced living in the South in Kentucky, Lexington, Kentucky, and I've experienced and witnessed apartheid and, all the obstacles and barriers that come with academic medicine and academia.
So to say that you have a world of experience would be an understatement, would you say?
Probably, maybe.
Yeah, for sure. Incredible, right? And as we highlight this Women's History Month, it's important to know that there are women out there that are doing incredible things and really blazing a trail, right? So what made you get into EMS in particular?
Well, it's interesting that you say that. At the time, my husband was a paramedic firefighter for Prince George's County, right outside of DC. So that population is actually bigger than the population of Pittsburgh. So he served a population of 800,000 folks. The beauty of Prince George's County, though, has one of the highest populations of affluent African Americans and Black folks, which sometimes you don't get to see in the width and breadth of the U.S. of A. So we got to witness that firsthand. But he was also one of the top 10 busiest stations in the country. And I recognized in him telling his stories of, trying to take care of patients or taking care of patients, there was a disconnect between EMS and the hospital. And I began to recognize that in my own hospital as I was working in the Pediatric Emergency Department in Baltimore. And I was intrigued by that disconnect because I felt that, the patient at the end of the day is the one who's at a disservice when we don't connect all of our healthcare entities together. Like I like to tell people that 911 call is really time zero. But that's really when the clock starts. Actually, somebody may argue when you become sick is when the clock starts. But the first healthcare provider that you may see is usually an EMS clinician. It may be a healthcare professional if you bring yourself into the hospital, but a lot of times it's an EMS clinician, and a lot of times we leave them out of the conversation. And when there is not that mutual camaraderie, respect of the work that's being done both in and outside of the hospital, it's the patient that suffers. And especially in dealing with pediatric patients, I noticed the disconnect, and I was like, I want to do more about this. And it's really my husband and his work in EMS that got me interested in doing an EMS fellowship. So I broached the Johns Hopkins people and I was like, look, I want to do this. And they're like, wow, you might be our first official fellow. They had 2 previous fellows. And they're like, let's do this. They took a chance on me and the idea of it. And it's been great ever since. Dr. Michael Levy and Dr. Asa Margolis and Dr. Nelson Tang been remarkable human beings that got me started on this EMS pathway, and I'm forever grateful to them for taking a chance on me in that space.
Wow. So just conversations, create an idea, and from idea, there was an action. And this is where you are today.
Yeah, 100%. I like the idea of understanding how to take care of patients both inside and outside of the hospital. Much of the work that I've done since college. In college, I started a program called Kids to College, where we brought underserved youth in the city of Rochester to our campus at the University of Rochester to experience college, just to experience it, because exposure is key to anything that we do in life. And so, whether that be going to a biochemistry course or English 101 course, these kids got to exposed to the idea of college. And ever since then, I've been very much a part of the community, and EMS is very much a part of the community. So it only made sense that if I was going to subspecialize in something, it would be EMS.
All right. So now you have these 2 worlds, right? We're told that EMS is a community, which is supposed to include the dispatch phase, the patient care phase on scene, and then the hospital phase, which starts in the ED, gets them to the floor, gets them discharged and rehab. But as you've eloquently stated, that there is this pre-hospital piece, and then there is this in-hospital piece. How have you been able to really connect those 2 so that the people that you work as a medical director for understand how they really cross-pollinate?
So the beautiful thing about being a pediatrician is, kids come first for me. Youth comes first, right? And, again, I love Whitney. I believe the children are our future. It sounds very cliche, but it's very real, right? Teach them well and let them lead the way. And I say that to say, I do a simulation training program. We're going on 8 years now, where our Pediatric Emergency Medicine fellows become EMS clinicians. So they can only work in the scope of practice of an EMS clinician, whether that be BLS or ALS. So you're really doing role reversal, really being put in somebody else's shoes. And that's what I recognized in watching my husband and interacting in the pediatric emergency department, is that other people were not getting the perspective of what it's like to be an EMS clinician, what it's like to be a paramedic in the back of an ambulance while maybe your EMT or other paramedic is driving, and you have to draw the medication. You have to make sure that the medication that you're drawing is correct. You need to apply the medication. You need to take vital signs all by yourself. So minimally resourced. And there are certain things that you're allowed to do, and there's certain things that you're not allowed to do. And so getting that broader understanding, having our nurses and our trainees and our physicians understand what it is that EMS clinicians do, what is their scope of practice, what is that make them so great in this resource limited world, I think has kind of helped narrow the gap. We still have a lot of work to do in the way of like sign out transitions. So one thing that we do at our hospital that I'm really proud of is we allow our EMS clinicians to speak first. So if they bring in a pediatric trauma or medical patient, well, particularly pediatric trauma, all eyes are on the EMS clinicians first before anything else to give. Well, sorry, we start with the ABCs. We make sure that the patient is okay enough. And then the next step is the EMS clinicians to report their sign out. And that everybody needs to be quiet and listen to the sign out, right? And so that shows, respect. That shows that, we are putting the patient first by putting our other healthcare, our pre-hospital colleagues first. And again, with the simulation, over 8 years, I've had a lot of our trainees just be very grateful. And like, I had no idea. I get it now that, that if a pediatric patient is seizing, that, that an EMS clinician may not have every single med under the repertoire. And if they are a BLS provider, that they can't give meds at all. And so, one thing I teach our trainees is that sometimes the closest ALS is not an EMS clinician, but the hospital. So sometimes when you see a patient come in and you're wondering why they didn't get certain medications or things weren't given, the BLS provider knows enough to say, you know what, this patient will be better off at the hospital than for me to wait for an ALS provider to give meds or start a line or do things like that. And I think understanding where other folks are coming from, understanding other people's perspectives, way of life, helps to make us better clinicians overall on both sides of the coin.
So the interns, the docs, the fellows, they get an opportunity to put themselves in the shoes of EMS clinicians, which I'm sure is an eye-opening experience. So because of your protocols, what have you done within those protocols that really shines light on we're different, we do things differently, and we aim for better outcomes for these clinicians so that when they get these patients to the hospital, that you can help improve outcomes?
Yeah, so I happen to have some room in that space to do that. So I am the Emergency Medical Services for Children Medical Advisor for the Commonwealth of Pennsylvania. And one of our main jobs is to look at our statewide protocols, particularly when it comes to pediatric patients. And what I'm able to bring to the table is real evidence-based medicine. So just like medicine, in hospital medicine, we lag significantly behind in the evidence-based medicine that we bring to the bedside to our patients. I would say that might be even more so in the pre-hospital realm with potentially outdated protocols. And so I think in the state of Pennsylvania, we've been very good at, we look at our protocols yearly. Every state is different, how often they revise their protocols, and really focused on evidence-based protocols. So what is the latest and greatest information out there, science-based information out there on, for instance, how to take care of a pediatric patient with a seizure? Currently, Dr. Manish Shah is doing a world-renowned study called P.O.D dose, looking at how we can streamline dosing for pediatric patients for our EMS clinicians to remove the cognitive load of having to do the math of a pediatric patient. So seeing if there is a certain volume or milligram per kilogram dose based on age, based on weight, that EMS clinicians can give for pediatric patients with seizures that will stop their seizures. So we bring those kinds of studies to the forefront. Dr. Julie Leonard has recently finished a remarkable trial on C-spine injuries in pediatric patients, and both pre-hospital and in hospital. leading to lessening the radiation that we do with CAT scans in the hospital based on the work that we do outside of the hospital, and taking care of our pediatric patients. And so thinking about spinal immobilization differently, thinking about the use of backboards differently, and bringing everything to the 21st century. And so that's one of the joys of what I do, is to be able to bring all of those things to the forefront. One of the problems in pediatric pre-hospital care is medication errors, dosing errors. And so being very specific about, length-based methods, all the types of all the types of products out there you can use, that EMS agencies can use based on their budget, to help streamline that medication dosing for pediatric patients. So all of those things I think are very important, and I'm very proud to be able to be a part of that, in changing a policy and protocol, hopefully more real time than we have in the past.
Okay, so being a part of change, that's what it's about, right?
100%.
So that sounds like work, right? I know you enjoy the work, but that's the stuff you get paid for. Then there's this fun stuff that you are having an opportunity to do. So what kind of projects, activities, what you into, Doc?
Oh man, that's a loaded question. That's a loaded question, but we'll try to streamline. I think, with the main thing that everybody sees, the glim and the glamour and the dazzle, is a couple of things. One, I'll start with my own, is that I was fortunate enough to have the opportunity during COVID to work on a film about my own work life as a Black female physician, in a homogenous community of academic medicine, meaning, in many cases, there's only 5% of active physicians are Black, and only about 2.3% of them are Black women, speaking about, Women's History Month. And so thanks to the folks like Dr. Rebecca Crumpler, who we stand on the shoulders on as Black physicians, we are here and we're able to do the work. And I had a wonderful opportunity to highlight that through a short film called In Good Hands, that highlights my experiences in the last few minutes to hour of a shift, culminating all my experiences in the way of microaggressions and overt racism. And that film is now the semifinalist for the New York City Indie Film Festival, which is noted to be only second to Tribeca. So very, very proud of that. And in the midst of that Hollywood film star genre, I had the wonderful opportunity of, literally a year ago, March of 2023, a good friend of mine, Dr. Beth Hoffman, works with a wonderful nonprofit called Hollywood Health and Society that looks to evidence-based medicine, bringing evidence-based medicine and medical experts to medical dramas or television shows in general. And they were looking for somebody to talk about racial disparities, health disparities in this new medical drama series called The Pitt, put on by the former executive producers and writers of ER. So I said, sure, I'll do it. So I, not thinking, fast forward to today is a whole nother story. But so I had the opportunity to do a Zoom call just like this and talk freely about the experiences I had, particularly in Western Pennsylvania, around healthcare disparities. I spoke about, that it's, and they asked the question, what would be important to highlight in this medical drama that you don't think has been highlighted before or highlighted enough? And so the first thing I said was, you cannot talk about healthcare in Pittsburgh without talking about Freedom House Ambulance. You cannot talk about the pioneers of EMS, of the 911 system that we know today. You cannot have a medical drama series and not highlight them. There are not enough people to know about them. And for those who still don't know about them, even in the EMS community, Freedom House Ambulance was built off of 25 Black men and soon women. I want to highlight the women. In a lot of the history that we're seeing now, it says the 25 Black men, but there was the first Black female paramedic. There were Black female dispatchers that made this run like a well-oiled machine. Miss Darnella Wilson is one of them. She started at the age of 17. So they came together with the leadership of Dr. Peter Safard, otherwise known as the father of CPR, Mr. Phil Halen, who was known as the Money Man, who led in the grant donations, and Mr. James McCoy Jr., who a lot of people don't talk about, but was lead of the NAACP at the time and was a laborer and organizer, community organizer and leader in the predominantly African-American neighborhood of the Hill District, which back in the day was the height of Black Renaissance, but it kind of faded away with poverty and drug abuse. And so had some of the worst health disparities in the city. And here between the leadership of those gentlemen and the 25 plus pioneers of newly minted EMS clinicians, the Hill District community got some of the best care ever in the country. So these Freedom House ambulance members were doing EKGs in the field and transmitting them in the 1960s. They were doing intratracheal intubations. They were pulling Narcan up before we knew about this opioid use disorder. They were drawing Narcan and giving Narcan to patients who had overdosed. They were going above and beyond. Before them, no one was taken care of from your house from your house to the hospital. There was no medical care. You're thrown in the back of a paddy wagon, otherwise known as a police car, or even a hearse. And good luck to you if you made it to the hospital. So these men and women transform healthcare in a way that no one has previously, thanks to the leadership of Dr. Safar. And it being Women's History Month, we'd be remiss not to mention Dr. Nancy Caroline, who was their EMS medical director, a female powerhouse, not unlike no other. I was told she was petite but powerful, and she was not. Nothing fazed her. She easily went into these Black communities, no judgment, was there to take care of the patients and transformed healthcare as well when she went back home to Israel and working with this Israeli EMS system there and transformed it there. And so, talk about you couldn't package history any more better than the Freedom House ambulance story in the way of diversity, in the way of equity of care, in the way of reducing healthcare disparities, and in the way of EMS. Every story is in that story of Freedom House ambulance. And so I said, you cannot do this show and talk about Pittsburgh without telling that story.
Wow. So it sounds like Freedom House will deserve its own podcast. So let's get that set up. Now, you mentioned in good hands. How can the listeners, readers, watchers find that? What platform is it on?
That's a great question. So right now, the way we've decided to get the movie out there is through film festivals. And how it goes is until you get a premiere at the film festival, the film is not able to be premiered anywhere else. So I say that to say that right now, we've done a couple of private screenings. We did 2 private screenings in Pittsburgh last year that sold out. We were able to do a private screening at Paramount Plus in New York City because our screenwriter works for CBS and Paramount Plus in New York City. But otherwise, we're holding tight. Hopefully we win something in one of these film festivals and then we'll get it out to everybody. And I will share with you the word on how to view that. But I appreciate you in bringing it up and letting listeners know there will be an opportunity in the future. And in addition to that, I am writing a book about my life as a pediatric emergency medicine physician and the pediatric patients that touched me, and interweaving my own life story in that. And so hopefully by the end of this year, I'll have my book out as well. What I can say is people can follow me at MD Owusu on Instagram, where I post a lot about Freedom House. We're working on a congressional gold medal for them. So you can get updates through my Instagram post or my Facebook post, Sylvia Owusu-Ansah on Facebook. That's where you can get updates about In Good Hands, Freedom House and the Congressional Gold Medal, and my upcoming book.
Is the Pitt being streamed now? Is that correct?
Yeah, so the Pitt's being streamed now on Max at 9 p.m. Eastern Standard Time. It drops every Thursday. But the beauty of it dropping in that form is that you can feel free to watch each episode as it comes out or binge later. And I think we're coming up to episode 10 this week.
Well, good. Our football season has ended. And so now there are shows that we need to binge, and I'm going to make sure I do that. And I'll have a full report for you.
I love that.
One more thing. You talk about, doing these things at, in Pennsylvania, you put your history in Maryland and really, getting things done. But you also participate on things at the national level, and that includes the National Association of EMS Physicians. Could you briefly touch on your role with that particular group?
Yeah, so I think like many folks, after the murder of George Floyd, we recognized, well, many of us didn't recognize, but maybe other of us who didn't recognize began to recognize that racism is still a problem in America. It's still very much an issue, and there's something that we need to do about it. And so there was an upsurge of what we call diversity, equity, and inclusion in many institutions and places throughout, which I see that as, just humanity, just looking to treat people as they should be treated. The titles, I think in the end of the day, don't really matter. But I was adamant to talk about, it's one thing to watch things happen. It's another thing to do something about it. And so I was very outspoken. I wrote our hospital's first anti-racism statement in 130 years of the hospital's history. And I called a lot of the national organizations that I was involved with and asked them to not be complicit, but to do something about it. And so through that, the National Association of EMS Physicians reached out to me to start a task force in this space, which then soon led to a committee, which then soon led to subcommittees that were able to put out scoping reviews on diversity, equity, inclusion in the workforce, in EMS, studies that hadn't been done prior. And we've been able to grow since then. And so I was happy in the first couple of years of being chair of that committee that we were able to do so many things in the way of even bringing Chief Moon as a guest speaker, one of our Freedom House ambulance members, able to bring Lieutenant Quentin Curtis, who puts together the Chicago Fire Brigade, which is one of the phenomenal EMS pathway programs in the United States, and really kind of changed the needle on that perspective. And I'm proud to be a part of that. I'm proud of we're 3 chairs in now. So I'm proud to be a part of that process and continue the sustainability in that space.
So how can someone in the EMS world participate in such an important group?
Yeah, I think people are asking the questions, how can I help with the Congressional Gold Medal? How can I, like our DEI committee for the National Association of EMS Physicians has been standing room only the past couple of years. I think people are getting involved. You can get involved with your local and national EMS organizations. You can start there, the National Association of EMS Physicians. I'm also on the board of the National Registry of EMTs, and we've been more focused on treating people like humans. We always have been, but we've been focused on bringing that to the forefront. And so I think leaning into a lot of your local agencies and your national organizations, leaning into your national organizations, to help you with your local agencies, I think is key. There are a lot of resources there that you may not be aware of. Especially with the National Association of EMS Physicians and a national registry. NAEMT has a lot as well, and the SEMSO. There are a lot of organizations out there, and the SEMC that are supporting what is needed and what is necessary to be done.
So the educators, the state officials, the national registry, the National Association of EMTs, all these groups, you can participate and get involved, and of course with the local chapter of the EMSP, correct?
That is correct. I will say that thanks to the NAEMT, I'm the daughter of 2 West African immigrants from Ghana, and last year I was able to go with the National Association of EMTs to Ghana to teach pediatric emergency care in conjunction with my own nonprofit, where we're able to teach 60 Ghanaian students, 60 children CPR. And so that's been another thing that I've been working on is I've taught over 2,000 community members in the past 2 years CPR, including all of the Division I Pitt athletes CPR, of which the record-breaking soccer goalie Ellie Breach, soon after our training, saved her dad's life with CPR. So there's a lot that goes in that. And I see CPR, thinking about Dr. Peter Safar, Freedom House Ambulance. I see CPR as what we do as EMS clinicians. A lot of what we do is that outreach, because for CPR and cardiac arrest, time is brain and time is life. And it's a lot of us in that circles that are providing that second chance at life when it comes to that space as well.
Wow. Incredible work, lots of stuff, right? Lots of good stuff, life-saving stuff, and meaningful stuff. And I know that your name's going to live well beyond your years because of what you're doing in EMS. And, I want to be a part of it. I want to help. I want the people that watch and listen to this to understand how far-reaching it can be by doing the work that each one of us can do to make things better and treat everybody like humans. So I really want to thank you for framing it in that perspective.
Well, thank you, Chief Randell, for this opportunity. This has been fabulous. It's always great to work with you, going all the way back to, I think it was 2020 EMS World, right? And so look up to you as well. You are the shoulders that I stand on as well. So thank you for the work that you're doing in this space.
Well, thank you. I want to thank all the folks that listen and watch this particular episode, and we'll have more to come with Dr. Owusu. And we look forward to hearing from you as we travel across the country. And if you have ideas for topics and guest speakers, please reach out to the EMS Pod at gmail.com. Again, thank you, Doc. And we'll talk again soon.
All right. Thank you. This was great.